I'm Sheth, and I'm postdoctoral research associate in Professor Sir John Burns' group at Newcastle University. My expertise lie in the realm of personalized medicine. That is, I hunt for genetic markers. The drug I focus on is warfarin, which is one of the most commonly prescribed drugs in the world. You have to give a very precise dose of this drug to an individual. As if you give a very low dose, then the blood is not thin enough and you are still at risk of stroke. If you give higher than required dose, then you risk thinning the blood so much that the patient will die because of bleeding. And when you take warfarin, a doctor will prescribe you a standard dose and will ask you to come every week until they reach the right dose. And for that, you would probably have to leave your work, you would have to go to the hospital, get your bloods checked, and then they'll give you a tailored dose, then you come back next week, and so on. So for the patient, the quality of life becomes very poor. From the doctor's standpoint, it becomes a lot of work because he has to see a lot of patients every week just to see how much dose they require, and that takes a lot of time out of his work. From the healthcare standpoint, it becomes a very expensive endeavor because for one patient per test, you are charging £80. And so it becomes a very expensive procedure to call the patient in, get the bloods checked, and then send them away again. In the future, that may not be the case because you would have technologies like this. This piece of technology called QPOC is a handheld genetic testing device which is being developed by QuantumDx here in Newcastle. Basically, all you need is a drop of blood in this cassette, put the cassette in, press go, and it carries out the genetic test in 20 minutes for just £20. So whilst you are at your doctor's clinic, you get checked straight away before you are being put on warfarin. What you need for a specific type of work are different sets of cartridges. So for warfarin, you might have this cartridge you can add in. The device will automatically recognize that you want to carry out a warfarin test, and it will start going. The box just consists of a whole bunch of syringes and pumps that pushes the liquid around in the cassette. It's in the cassette that all the stuff happens. That is why you can, once the cassette is done, you can take the cassette and throw it away. What it does is it basically lyses your cell. It breaks open your cell so that all the DNA is now out. You then filter the components of this lysate through a little filter which basically binds all the proteins, all the lipids that are there in your cells and allows the DNA to go through. So you now have pure DNA in the cartridge. It then goes through a series of channels which are heated and cooled over 35 times. And this process is known as polymerase chain reaction. Your amplified DNA is then pushed through a chamber which consists of a very thin strips of silicon called silicon nanowires. These nanowires are also found in your mobile phones and computer laptops. But in this case, we have used them to do sensing of DNA. Because these nanowires are about 10 nanometer in length, it gives them a specific property known as field effect transistors. Basically, if you have a charged molecule around nanowire, then it changes the amount of current that is passing through them. And using that technology, we can detect if in your DNA you have a marker or not. And that's how this device carries out genotyping. Now, if for the next patient you want to detect whether the patient carries malarial parasite, you take another cartridge, put it in, it will detect that you want to carry out a malarial parasite test, and it will start the work accordingly. Recently, QuantumDx got funding from the Gates Foundation to develop a cassette that will help in detecting whether you carry drug-resistant TB or not. And accordingly, we can give you the right medication from the very beginning. And this will help in lowering the global burden of antimicrobial resistance. In areas like Africa, or where you have an epidemic situation like the one we had with Ebola and now with Zika, what you can do is that you could go to remote areas, you could carry out the test, and once you're back in your hospital and connected to Wi-Fi, it will transmit all the location information, and it will help policymakers to decide where to send necessary help. So you are now doing real-time detection, surveillance, and help, and providing help in necessary areas.